Anxiety and depression run hand in hand. Usually you're not depressed without being anxious. For most who suffer from these debilitating mental illnesses, find it a lot harder to do everyday things, like getting out of bed. The thing is, there are a lot of people out there who have the mentality not being sad is the best way to deal with it. It's more complex than that. It can be argued just sucking it up does nothing. Let's put some information into perspective. Humans have a 1 in 3 chance of developing an anxiety disorder. Studies have looked at almost 400 people aged 18 to 94 using standardized tests for anxiety and depression. 6% of subjects showed signs of anxiety, 12% depression, and 5% showed a mixture of both. Everyone gets sad at one point or another, and everyone else seems to pull themselves out of that rut. So why is depression different from sadness? Depression is hard to diagnose. The idea that when you have an issue, you can just deal with it is so prevalent in our society that only 1 in 5 patients suffering from depression are diagnosed and treated. With such a low diagnosis rate, it's clear that those who suffer from anxiety and depression are not getting the help they need. And what about students in school? Students studying at a post-secondary establishment who try adaptive coping for their anxiety and depression found it had very little effect on helping them. It even gets to a point where it can affect a person's everyday life. It can cause the person to work less, lose productivity, and adds higher risk of suicidal ideation, all because they suffer from anxiety and depression. When it gets to a point where their physical health is at risk, just like any other sickness, telling them to suck it up would be the same as telling a cancer patient to not feel pain. So what options do people suffering from anxiety and depression have if sucking it up doesn't work? Medication and therapy. When in conjunction with cognitive behavioral therapy, medication has shown a significant decrease in anxiety, which also shows a positive correlation with a decrease in depression symptoms. Selective serotonin reuptake inhibitors were found to be effective in recent studies, and also effective in treating disruptive behavioral disorders like ADHD. Studies have shown that medication along with therapy have done more to help people suffering from anxiety and depression. So why do some people still believe that mental illness shouldn't be treated the same way we treat a bruise or a cut? We need to reshape mindset around mental illness. Treat anxiety and depression like the disease that it is, a serious injury. Like a runner who has broken his leg, no one is expecting you to run a marathon with an injury.